In this video, we're going to be talking about canine osteosarcoma. If your dog has been given this diagnosis, I am very sorry. Stick around, I'm going to tell you everything you need to know. Hi, I'm Dr. Vanessa Rizzo. I'm with Hope Veterinary Oncology Services. We bring veterinary cancer care closer to home. So, what is osteosarcoma? Unfortunately, osteosarcoma is a very aggressive tumor of the bone. It typically comes on very quickly and kind of eats through the bone, which is very painful, and a lot of patients will present with lameness. So whatever leg is affected, they're usually unable to use that leg fully or at all. Now, what do I mean by aggressive? Well, aggressive can mean one of two things or both of these things. So aggressive could be locally aggressive, so a tumor causes a lot of problems right where it starts. So for bone tumors, it will cause problems within the bone itself. It destroys the underlying bone. Sometimes it makes bone where there's not supposed to be bone. It can lead to fractures, and it can be very, very painful. Aggressive also refers to a tumor's ability to spread to other locations. And unfortunately, with osteosarcoma, that's very common. Even though this is a very aggressive cancer, is there anything we can do to help these patients? Well, the answer to that is yes. There's a lot of things we can do to help these patients. So first, we're going to talk about what we in the veterinary field call the standard of care. What we would recommend for the average patient with osteosarcoma who is otherwise healthy, and if we had all the resources in the world to do what we think is the absolute medical best. And then we'll talk about some other options if that standard of care plan is not an option for you, for your family, or specifically for your pet for whatever reason. Now, the standard of care for osteosarcoma typically starts with an amputation. I know that sounds daunting and maybe a bit crazy, but most dogs can really thrive on 3 legs. A large majority of dogs simply feel better without this excruciatingly painful tumor attached to them. Now, I know a lot of you probably still don't believe me, but I've been in veterinary medicine for almost 20 years now, and I've been practicing oncology for about 14 of those years. And what I have learned in that time is that dogs are not small humans. They do not feel sorry for themselves. They, as far as I can tell, don't wish for a life that used to be the way we do. They are very, very good at accepting their situation and moving on. They also don't seem to be aesthetically or emotionally attached to their body parts. Now, look, every dog is different. I get that they all have their personalities, and some of them are very, very sensitive. But for the most part, most dogs after that surgery, within a few hours to maybe 24 hours, are up and walking around and looking for a way to get into trouble again. So if a patient is a good amputation candidate, meaning their other legs are sound, they don't have a significant amount of arthritis, they're all older dogs, so they all have some arthritis, which we can manage, but they don't have a significant amount of arthritis or neurologic deficits, then I'm going to recommend amputation. Now, that being said, amputation doesn't usually cure a patient with osteosarcoma. Osteosarcoma, again, is very aggressive and will often spread to another location even after the primary tumor has been removed. So we like to follow up surgery with adjuvant care, meaning we do something after surgery to continue to treat that cancer. For a lot of patients, that is traditional IV chemotherapy, a drug called carboplatin. Now, don't go anywhere. I know I just said the word chemotherapy. I said the word amputation. Now I'm saying the word chemotherapy. Hopefully you haven't tuned out yet. Chemotherapy is very different in veterinary patients than it is in humans. We really are striving to maintain an excellent quality of life while a patient's going through treatment. Believe me, I know you don't know me, but if all I did was make dogs sick all day, my job would really stink. I don't want that, my nurses don't want that, and the families don't want that. We are not going for quantity at all costs. But chemotherapy can be pretty effective at least slowing cancer down in dogs. So at the doses and the schedules that we use in veterinary medicine, roughly 75% of dogs do not have any negative side effects to their chemotherapy. Roughly 20 to 25% will have something, and it's usually mild, decrease in energy, maybe a slight decrease in appetite, maybe outright vomiting and diarrhea, and maybe that's severe and lasts for days. But if that happens, we're going to change the plan. I know for my patients, if that happens, I'm going to change the plan. I'm going to decrease the dose of carboplatin next time, or maybe I just needed to add a supportive medication. Maybe the problem is a low white blood cell count, and what I need to do is, instead of giving it every 3 weeks, I'm giving it every 3.5 weeks or every 4 weeks instead. My point is there are a lot of ways to change the plan. We change the plan according to that particular patient. Whatever's going on with them, we're going to make adjustments. And if that doesn't work, we're going to make some more adjustments. Now, usually we're treating with this drug every 3 weeks for somewhere between 4 and 6 doses. During that time, we're not only monitoring for side effects, but we're monitoring for efficacy as well. So we're looking for evidence of metastasis during treatment. We're usually doing that with a physical exam and chest x-rays, looking for nodules in the lungs or pain in any of the other bones. Now, when we do this, when we treat with surgery followed by chemotherapy, we're usually seeing an average survival time of about 9 to 12 months. Some patients live much longer. Some patients, unfortunately, have very resistant cancers and they die quicker. Now, is there anything we can do to extend that survival time? Or is there anything we can do if IV chemotherapy isn't an option, or we tried it and it just didn't work out? Or what if amputation isn't an option? Well, there are a lot of treatments out there that we could consider in these situations. So let's start with amputation's not an option. If amputation's not an option, then I would be aggressive with pain control for sure. I would give an IV drug called zoledronate. This drug slows down bone destruction, no matter what the cause. So if that bone destruction is being caused by a tumor, or in people, osteoporosis, zoledronate could help. Slowing down or stopping bone destruction will alleviate pain. And then I will also give several oral pain medications, because bone tumors, again, they're not only super painful, but that pain is being caused by multiple mechanisms of action. And so we want to treat with kind of a concoction of medications to turn off those different mechanisms. I know, we don't want to just throw a bunch of drugs for the sake of it, but when it comes to osteosarcoma, it's actually pretty important. Now, is there anything we can do to slow down the cancer directly? And the answer is maybe. Traditional IV chemotherapy has not been shown to really be effective if we can't first do the surgery and kind of reduce the disease burden on the body. So I wouldn't generally recommend traditional chemotherapy. What I would try is something referred to as targeted therapy. So what do I mean by that? Well, chemotherapy goes into the body and kills rapidly dividing cells indiscriminately. Tumor cells are usually rapidly dividing, but so is the lining of the intestines, and in people, your hair follicles are rapidly dividing. And so that's why you see the side effects that you do from chemotherapy. Targeted therapy, on the other hand, does just that. It targets cells with specific genetic mutations. So for a lot of my patients who are unable to have an amputation, I will try some sort of targeted therapy in addition to their pain control, to try to help keep that cancer under control for as long as possible and keep the patient feeling as good as they possibly can. Now, do targeted therapies have side effects? Well, they could. They could, just like chemotherapy, cause a decrease in energy, a decrease in appetite, diarrhea, changes in lab work, but for different reasons and by different mechanisms than the chemotherapy does, but you can still see the same effect. In my experience, most targeted therapies are just as well tolerated as a lot of the IV chemotherapies that we use at the doses that we use them. And all of the targeted therapies that we use are oral. So these are drugs that you would give at home in addition to those pain medications. We're still monitoring for side effects. We're still monitoring for efficacy. And so I'm usually seeing these patients once every 4 weeks, sometimes once every 6 weeks, depending on the situation. Now, what if we were able to do an amputation and we tried a dose or two of carboplatin, that traditional chemotherapy, but it just didn't work out? The patient had side effects, whether it interfered with their quality of life or it was stuff that I was seeing on my end in the lab work. We tried changing the plan, we gave another dose, and it just didn't work out. Well, in that case, I would use targeted therapy instead of traditional chemotherapy. Because using targeted therapy specifically for osteosarcoma is still a relatively new way of treating. I've been doing it maybe for about 5 years. Other oncologists are probably doing it maybe for about 6 or 7 years now. And while that sounds like a long time, it's actually not enough time to gather a significant amount of data on whether or not these drugs are truly helpful. What I can tell you is that I've been treating a lot of different types of cancer with different targeted therapies, and I would say maybe 50 or 60% of the time, I see a very good response. I see that cancer go into remission for some period of time. It could be 3 months, could be 18 months, depends on the patient. But that's why I continue to use targeted therapy, either when IV chemotherapy is not an option, or when we know traditional IV chemotherapy has never been shown to be helpful. Now, what if you're one of the millions of Americans who do not live near a veterinary oncologist? Maybe you're able to get the surgery done, but you don't live anywhere near a veterinary oncologist to administer IV chemotherapy. For the past year, I've been helping pet parents and general veterinary practitioners from Alaska to Georgia help patients just like this. I first do this by reviewing the medical record and then chatting with the pet parent. We talk about what the general practitioner has already done, what tests have already been done, and what the diagnosis is, what that means. What I can't do when I speak to pet parents is make the diagnosis, because I haven't done a physical exam and I haven't run the test myself, and I can't prescribe any medications. But what I can do, if the general practitioner is up for it, I can provide written, detailed, comprehensive treatment plans or guidelines so that that general practitioner can implement that plan no matter where they live. I am then available for any follow-up questions from the general practitioner. So if I provided a treatment plan and he or she implemented that plan and then something unexpected happened, they can reach out to me, tell me what's going on, and then I can tell them how to change the plan according to whatever's going on. Again, if you're watching this because your dog has been diagnosed with osteosarcoma, I'm very sorry. This is a very aggressive cancer, and it is okay to be very angry and sad about this. Knowledge is power. If you do live near a veterinary oncologist, I encourage you to make an appointment for a consultation. That consultation does not commit you to any one treatment or another, but that information will be very valuable to you. If you don't live near a veterinary oncologist, I encourage you to ask your general practitioner if it's okay to reach out to me or another virtual oncologist out there. Again, my name is Dr. Vanessa Rizzo. I'm with Hope Veterinary Oncology Services, and we bring veterinary cancer care closer to home.